Hello, this is Aprendiendo Juntos, learning together, learning to provide care. My name is Dr. Rocio Norman, and this is module number 4, Optimizing Swallowing for Persons Living with Dementia. In this presentation, we will discuss how to identify signs of swallowing problems and possible complications. And we will also discuss strategies to minimize swallowing difficulties. So to begin, we'd like to define what is dysphagia. Dysphagia is a term that's used a lot when caring for loved ones with dementia. So dysphagia is when someone has difficulty safely swallowing, and this can lead to many other health complications. Often it manifests itself as taking a longer time or requiring much more effort to move liquid or food from your mouth to your stomach. Some of the signs and symptoms of dysphagia can be very subtle and sometimes hard to spot, but some signs to watch for during mealtime include increased coughing and throat clearing, food spilling from the mouth while struggling to eat or drink, and chewing for an abnormal length of time. Some long-term signs to watch out for include weight loss and changes in how clothing fits, also dehydration. Some other complications caused by dysphagia include malnutrition, weight loss, and dehydration, and these should be consulted with your medical provider. And a more dangerous complication from dysphagia is aspiration pneumonia, which is often caused when food goes into the respiratory system. And up to 40 to 53% of individuals with dementia can acquire aspiration pneumonia that can require hospitalization and can be life-threatening. So dysphagia is more than just a swallowing disorder. It can really affect a person's quality of life and their long-term health. Some things that we can do to help your loved ones who might be having some symptoms of dysphagia. Well, the first thing that you can do is work on the swallowing strategies while they're eating. To begin with, you want to make sure your loved one is awake and alert when they are eating. You want to make sure that they alternate bites of food with sips of water or any liquid to help the food go down to the right pipe. Make sure food is all swallowed before they take the next bite. And allow your loved one to self-feed as much as possible to build their awareness and so that they are aware of the timing and the positioning of the food. Also, regarding positioning, you want to make sure that your loved one is sitting in a comfortable and upright position. If that involves including some pillows or changing their chair to a chair that provides more stability, you are more than welcome to do that and highly encouraged to do that as well. You also want to minimize distractions. Try to turn off the TV or anything that's really stimulating during their meal times. Maybe just have them eat in a quiet and calm place. Only provide the utensils and the cutlery that they will need for their meal. So try to limit the amount of items in front of them so that they don't feel confused or disoriented. So for more tips or diet modifications, which are changes that you can make to your food in terms of the consistency and the texture of food and liquids, we want you to refer to a speech-language pathologist and your medical provider for these diet modifications. Also providing external cues, such as visual reminders to your loved one that it's mealtime. Verbal prompts like keep chewing or did you swallow that bite to ensure that they are eating safely. There are also devices that are freely available on the open market. So websites just such as AliMed or Google Shopping can provide a plethora of devices that can help with being able to ingest food more safely. Textured spoons, maroon spoons, and flexi cut cups allow your individual, your loved one, to be able to eat just one bite at a time or one sip at a time. So definitely consult with your speech language pathologist or occupational therapist for some help in deciding on which devices might be most appropriate for your loved one. In closing, I want you to think about one tip you have learned that you plan to utilize with your family member regarding eating or drinking safely today and for the rest of the time that you care for them. Thank you for your time today. It was a pleasure being with you.